Morning, everybody. If we can take our seats, then we can make a start. Okay. So good morning, everybody. Thank you for rejoining us, those of you who are with us live in Manchester, and welcome to those of you who are joining us via Zoom or on the YouTube channel. It's great to see so many of you here this morning. We've got a lot of people joining us online, so it's great to see you as well. And I think the conference has gone extremely well so far. We've had some really good discussions about the national course study on transmission called PROTECT. And I think the researchers have been extremely open about the work they've been doing and what they've been finding. And the intent now is to share some of that with you more broadly, because it's important those people who need to use the information can access it in appropriate ways. My name's Andrew Curran. I'm HSE's Chief Scientific Advisor and Director of Research, and I've had the pleasure of leading this programme since it was started in October last year. And the joy on my face and everybody else's faces yesterday when we could actually meet for the first time was a fantastic thing to see. And hopefully the joy will continue over the next few hours as we include a panel discussion about why transmission is such an important thing to understand, and as I say, then to provide us with some information about what the PROTECT study has delivered. We're going to kick off with a are we doing the video first? Sorry, yes. So we're having a video from Sarah Alban. Sarah is the Chief Executive of HSE. This study has been funded from some money from Treasury that has been given to HSE. So Sarah was very keen to just give some thoughts on why this work is so important to HSE. So can we play the video, please? Thank you.
Good morning. On behalf of the Health and Safety Executive, I'd like to welcome you to the first conference of the PROTECT National Core Study. I was delighted when, over a year and a half ago now, HSE was asked by Sir Patrick Vallance, the UK Government's Chief Scientific Advisor, to lead this vital programme of work. It's a strong endorsement of the scientific capability and reputation of our organisation in general, and of our science division in particular. It's also a reflection of our commitment not only to basing our regulatory work on the most rigorous research available, but also playing a leading role in deepening and broadening that evidence base. However, the research insights generated by the PROTECT programme have not just been created by scientists at the HSE, but by a multi-institution, multidisciplinary team of over 200 researchers from 20 academic and government partner organisations across the UK, expertly led by HSE's Chief Scientific Advisor, Professor Andrew Curran. I want to extend my own thanks to those researchers, many of whom are in the room today or watching online, for their world-class expertise, hard work and commitment throughout the COVID-19 pandemic to improve our understanding of how the virus is transmitted and how it can be controlled. These insights, based on extensive real-world investigation and observation, have helped enable HSE to support the production of practical, usable guidance and advice businesses and workplaces need to limit transmission and to keep their workers and customers safe. For example, the expertise provided through the PROTECT portfolio of projects has helped us to provide guidance on one of the most difficult issues for businesses to address, namely ventilation. The overwhelming majority of these workplaces are keen to do the right thing. With over 300,000 spot checks carried out by HSE on businesses to date, 96% have been found to be taking measures in line with our COVID-19 guidance. Going forward, the work of the PROTECT study will continue to be vital in informing how we sustainably navigate living with COVID-19 as an endemic disease. I look forward to the further development of the evidence base that will be presented today. Thank you.
And thanks to Sarah for sending us that message. It's also fair to say that I met with Patrick Vallance last week, and he was very keen to pass on his kind regards and best wishes for this meeting. Clearly, when Patrick set the National Core Studies up, he was very clear that transmission was one of the critical issues for us to understand when it came to this virus. So he just wanted to make you aware that he was keen to be here, but unfortunately his diary wouldn't allow. We're going to move on now to some audience participation, and this is for the people in the room and also those people who are watching. So it's a great pleasure to introduce Professor Marty van Tongeren, who's going to run you through the questions and answers to help set a bit of context for the conference. Thanks, Marty.
Thank you, Andrew. Thank you, and nice to see everyone. And welcome to all those online too. So we have a brief poll that just tries to get some information out of the audience online and here using a Mentimeter. So if you have a device, a mobile phone or a computer with you, if you would like to go to this website, www.menti.com, and then enter that code that's on the screen, 700871135. And then we have just about 4 or 5 questions that we'll go through about work, about your perception of risks, etc., in terms of transmissions. So hopefully most of you will be able to do that. I have done that. So I'll go to the first question. And this is a question about how you worked. So the first question is, prior to the pandemic, which of the following environments did you most commonly work in? And I can see the number of responses going up. So shared office space is the most commonly reported so far, which is probably not surprising given the kind of like the audience that we have at the moment at this conference. So I'll leave it a little bit longer because I think we're still getting responses in. So 3/4 shared office space, a kind of a tenth or so, I think, in terms of private office spaces. A few people also already kind of working from home prior to the pandemic. A small number of people public facing and a number of mixed. So I think that's stabilized now. I think so. We'll go to the next question. And not surprisingly, the next question is about what changed after the pandemic. So between April 2020 and July 2021, how often did you work from home? And you can see now a slight variation in the way that the results are presented in terms of these little balls going into the options. So a large number of us, again, not surprisingly, are working from home all the time. And if you then add those that are 50% and 75%, you can see that we, in a sense, we're kind of probably a lucky population in that we will be able to work from home a lot, so we didn't have to travel and kind of, in a sense, have a kind of risky behaviors in terms of that work and the traveling to work. So I'll go to the next question. There's still a few people coming on, but so the next question is, currently, which of the following work environments do you most commonly work in? So home, private office, and I think because of the previous question, it's quite clear that the kind of home environment is going to be a much more kind of important than it was prior to the pandemic. So I think prior to the pandemic, we had about a small handful of people kind of saying we work at home, but now it's clearly a much bigger group. I'll go to the next question then too. So this question is really about your perception of risk in terms of SARS-CoV-2 transmission. So if and when you visit your workplace other than home, what do you think is the most important factor that will impact SARS-CoV-2? And this time we'll ask you to just enter a kind of a word, and that will then translate into a word cloud on the screen. And Clearly, the themes that come out are ventilation, and it's probably interesting because maybe if we asked the same question a year ago, perhaps that wouldn't have been come up that prominently. But masks wearing, so that kind of behavior and kind of proximity are kind of important themes that come out of this. I think this may be the last question. So I'll leave this up for a little bit longer. So this was just kind of like as a kind of an introduction. It was slightly lighthearted. Hopefully that was of interest. It showed we're not doing this as research, but it kind of demonstrates some of the things that we've been trying to do as well to trying to get people's perception of risk and working. So I think this is the end of that little poll. Thank you very much.
Thanks very much indeed, Marty. So hopefully that was an interesting start today and just shows perhaps how things have changed significantly since the pandemic. And it's useful just to be reminded sometimes, isn't it, of how big that change has actually been. What we're very pleased to present to you now is a panel discussion with some really important guests who have been playing an important role during the pandemic. And what we want to do is really just to explore some of the issues that they've had to face as part of their roles, and in particular, how that has interacted with the work that we've been doing from a transmission perspective through the PROTECT programme. So it's a great pleasure for me to introduce Paul Monks, Emer O'Connell and Fliss Bene. And I'm just going to ask you if you wouldn't mind just giving a brief introduction to yourselves and your roles, and then we'll take some questions from me, and then we'll open it up to the audience. So Paul, do you want to go first?
Thank you very much, Andrew. Can you hear me? Okay, so I'm Paul Monks. I'm the Chief Scientific Advisor for the Department of Business, Energy and Industrial Strategy. Erstwhile, I don't remember, but attendee at things like SAGE, EMG, and I also co-chaired the transmission group within the SAGE structure as well, looking at transmission by place or work thing. You might say, well, why have you got the Chief Scientific Advisor for the Department of Business, Energy and Industrial Strategy here? You know, what's he got to?
Oh, there you go. What's he got to do with any of this other than his inability to operate the basic audiovisual techniques? Well, FAIS owns the so-called workplace guidance, the guidance that structures all the advice about how people should behave in the workplace. So actually, we've been kind of at the heart of trying to translate much of the stuff that's coming out of the scientific information into practical information. We don't do it by ourselves. We've got our great colleagues at the Health and Safety Executive. I have to give a big call out for, we don't do it all on our own around this, but that's it. There's other angles of BEIS as well, which are strange. You know, we also run the OPSS, the Office for Product Safety and Standards, very much drawn into the question about the efficacy of the air purification and the sanitation stuff. And also we're responsible for various business sectors that have been very hit by the pandemic. The hospitality sector. I now know more about weddings than I really wanted to know, and the advice around the transmission risk at weddings, which I'm more than happy to talk about, as well as business events like these. I mean, I think it's a bit of a long introduction, but I think my finest COVID moment is that I was a co-science lead with Tom Rodham from DCMS on the events research program, and I got to go to the Donington Heavy Rock Festival to look at COVID transmission at the Donington Heavy Rock Festival. That was quite a highlight. Probably though succeeded by having to go to the FA Cup final, to watch Leicester City win. And if you're a Chelsea supporter, no. Yeah, and actually, by the way, we don't know I'm from Leicester. And that was probably my COVID highlight, having to go to the FA Cup final and seeing Ben Chilwell's goal disallowed and the Chelsea faces. That's my COVID moment. Sorry, I've heard into football.
Thanks very much, Paul. And you can see the hard life of a Chief Scientific Advisor in vivid detail there. And as a Sheffield Wednesday fan, I can only sympathise with the FA Cup, as we've not been there for many years. Emer, do you want to go next, please? Thank you.
Is that working?
Yes.
Yeah.
The microphones are all set to on, so you should be okay.
Okay, thanks. My name is Emer O'Connell. I'm a consultant in public health with the UK HSA, and I work as a senior public health advisor in PHAGE, which is the Public Health Advice and Guidance and Expertise function within the national response. So in that role, I provide public health expertise to inform the guidance, the advice and guidance for the public, and also some of the workplace guidance. And I also give advice to policy leads across government. So that can take many forms, but a lot of the work that I've done across the pandemic is transmission related. That has not involved me leaving my house for any purpose apart from going to the office. So I think I feel a bit shortchanged, although I don't enjoy moshing, so that's probably for the best.
Thanks, Ema. And Fliss.
Hi, I'm Fliss Bennett. I'm the co-chair of the Technical Advisory Group, which is sort of a SAGE for Wales. I sit and have been very privileged to be involved with not just SAGE, but the environmental modelling group, the transmission work that we've done, and generally asking awkward questions of wiser people than I. I'm a generalist, and we decided, since we have very few people in Wales, but it was very clear that we were going to need to do quite a lot of work, that we would role share. So I role share with the Chief Scientific Advisor for Health, Dr. Rob Orford. I'm here because I'm the prettier and slightly less bearded version of him, with more entertaining answers, apparently. And certainly one of my COVID highs has been having a hamster named after me, which I knew was going to do great science before it passed on to hamster heaven. It's been really difficult for everyone. It's still really difficult now. I'm a generalist rather than a specialist in molecular biology, virology, and bringing together the understandings that we have about behaviour, about the sort of vast variety of clinical and lab service sciences, some of the wider risk associations, and distilling it down and working out what the communication of science into policy is going to be, to talk to not only officials and ministers, but to sit in unofficial briefings with the sort of collected science journalists and not science journalists in Wales and the wider UK, explaining things in terms that are going to have meaning to people who aren't literate in science and who aren't living this every day, has been an almost impossible task, and is only supported because of people like researchers on the National Core Studies. So I'm here to sort of talk to you a bit about what it's like trying to take the wonderful sort of primary and secondary research that you do and translate it into something actionable in a government setting, but also to say thank you, because we stand on your shoulders and have been doing for the last 2 years.
Thanks so much indeed, Fliss. One of the things that I think is really important for us to recognise is that, given the fact that we've got people streaming in, we've got a really mixed audience today. So we've got the research community, we've got businesses, we've got local authorities, we've got a whole raft of different end users and individuals who clearly have different interests when it comes to COVID. And I think that one of the great things about the panel is that they provide a critical link between the research community and the outside world by undertaking a translation role. And that's one of the things I want to try and focus on during the conversation this morning. But I wanted to start really by just maybe picking up on the point about why transmission is important to understand. And from your perspective, how have you been thinking about the transmission issue and feeding that into the information that you've been passing on to others? Let's start with Ema on that one. Thank you.
When we first started out, we were only able to use the information we had from basic principles around IPC and other respiratory infectious diseases. And some of the decisions we had to make about the guidance, and it continues today, is that every decision you make involves trade-offs, and you can't reasonably judge those trade-offs without good information about what the risks are for the very activities that you're trying to manage. So, for example, at the very start, we were looking at care of the deceased and the management of funerals. And you can say, well, we're going to absolutely reduce the risk of exposure in all of those circumstances, but that isn't practical, because there are consequences to that. So removing people's ability to mourn at a funeral has consequences for it. You can reduce the risk to zero by banning them altogether, but that actually isn't proportionate. But what is proportionate? Those are some of the key questions, which have really, really important consequences for people's lives, their concerns, their anxieties, as well as their well-being in the future. So the evidence that's been collated over these years and months, well, I guess it is coming up to years, has allowed us to make educated judgments and evidence-based judgments. Now, more and more, we're using the evidence to guide those judgments and to make those trade-offs and to make it explicit that we're making trade-offs and the evidence we're using, and also where the uncertainty lies. So we know a lot about where the uncertainty is and how to gauge that too. That's really, really helpful.
Thanks, Emer. I want to pick up on that uncertainty issue later on, because I think, as you say, it is really important. But Paul, let's come to you and interested in your perspective on why understanding the importance of transmission and the routes and modes of transmission was important in your perspective.
Yeah, I mean, for me, it lies at the heart of that thing Emer's talking about, which is trying to work out how to develop proportionate interventions, you know, across it. I think there's something that, you know, if I think about what we've learned, there's a want, and I come from a business department, and there's this very false dichotomy sometimes that runs between health and wealth. You know, and you know, it is an absolute false dichotomy, because you get the health right, the wealth will flow out of it. But you know, what is the biggest lesson that I kind of learned about this? There's been a want since the beginning to compartmentalize transmission. And I know Andrew and I have spent hours on, you know, on the people going, I want to know what the transmission risk is in a nightclub. I want to know what the transmission risk is at a wedding. I want to know what the transmission risk is in X or Y setting. And I think what the PROTECT study and our understanding of transmission has done is it's drawn this kind of spectrum of transmission. You know, and we just kind of say every time, you know, you cannot just separate it out. You can't just say it's here. You know, if you go to a football match, you catch a bus or a train, or you use public transport. You know, and I think putting that together and being able to present that joined up picture, because the experts that we've had access to can pull all the different parts together, and at the heart of it lies, I guess I would call it a mechanistic understanding of transmission. It's a model, at least, of transmission. That's been very useful, that model of the three elements of transmission, to help us then put that in that context, that continuum spectrum context, to be able to then provide, sometimes I would say, uncomfortable advice, because, you know, people have wanted to stop one thing or the other. And actually, kind of what the evidence has kept saying is actually only large-scale interventions are effective at really racking back on the virus.
Thanks, Paul. And Fletch, from your perspective, why is it important to understand transmission routes?
I think as we understand more about the transmission routes and the transmission risks that there are, and the levels of uncertainty around, I'm going to speak forward rather than looking at you or vanish. There are orders of magnitude of difference between the transmission risks we have. And we've sort of found that there are two approaches. One, as Emer said, the inequality is a huge issue. When we talk about opening up, we want to offer advice that's going to allow people to have as much of their social and cultural and economic and educational benefits as possible, without increasing the transmission back to a level where the direct harms outweigh the benefits that they're getting. In order to do that, we need to have enough understanding of what the dynamics of transmission are going to do, so that we say, when you allow society to move back into this area of its life, it is likely to have this effect on the epicurve. More than that, when we're asked for advice, increasingly specific advice about, and fascinatingly, a lot of advice requested about the nighttime industry, which has led to some of my young members of staff learning more than they ever wanted to know about what happens after sundown in certain areas of the cities, and how that can help transmission of COVID. You need to kind of come back to what's the weakest link. So a minister or a union or an official who wants to help a sector open up says, you know, what are the things that I need to tell people that they should do in order to reduce the risk of transmission And you can say, there are these different touch points, you know, have you thought about things like where somebody keeps doing the door? Have you thought about hand cleaning? Have you thought about ventilation? You know, are you going to keep your door open? But more than that, they say, well, what's the riskiest part of somebody coming to the shops? And you sort of look at them and go, well, are they coming in on public transport, you know, which is not well managed? Are people car sharing before they get to their very well maintained factory? Are people all going to the pub afterwards? You know, are you factoring in the fact that no matter how well regulated the school is, if the kids are all having sleepovers or, you know, playing pile on as soon as they get out of that regulated area, that's the area where the biggest risk is. And one of the really awful parts, sort of sneaky parts of this virus, rather like sort of discovering that most of the transmission occurs in people who are asymptomatic. And everybody is asymptomatic for the sort of first 48-hour period, even if they go on to develop symptoms. That, you know, so much of the transmission occurs before you know about it. In the same way, a lot of the places where transmission can occur are places which are not regulated. So our advice can no longer be just about how can you regulate, how can you advise people to manage their own risks. It has to be about how can you help to educate the public and get them to care enough and understand enough about how transmission occurs and what's going to happen to them as individuals and as a population if transmission is too high, and then help them get through. And that's scary. So you can't just come out and say to a population, this is what you're going to be with for the next decade. Sorry, it needs to be done in a way that people can go through the cycle of denial and understanding and grief and come out going, actually, there is something we can do about this that we're prepared to live with.
Thanks, Fliss.
And Andrew, if I could just come in. I mean, the point that Fliss makes is really important about, you know, it's people. You know, and we kind of forget about this when we talk about the mechanism. And you know, there's another big lesson, you know, that we've learned. We've got to think of this as a socio-technical problem or a socio-behavioral problem, alongside it being the kind of the biology that underlies it. And you know, the biology is in people and people interact. And I think that is another feature of how we've had to translate advice. And, you know, again, within the SAGE structures, it's kind of well known that actually behavioural science has been really useful in helping us frame advice, because often it's taken the very technical understanding that you guys have been giving us, but actually frame that in a behavioural context, you know, about that. And you can see that at the moment. You can see that exactly at the moment. You know, face mask wearing on trains. You know, it's a good measure of social compliance, isn't it?
Fliss, sorry, let's go for Eva first, then Fliss again.
Yeah, just to echo that, I mean, before COVID, we would have worked quite closely with our behavioural science team, and now they are totally embedded in everything we do. I rarely have a piece of work that I'm working on where I don't partner with one of our behavioural scientists. So they have been utterly invaluable in the work we've done, and working with them, I translate the work that's coming out of Protect and from the EPI as well, and explain to them what the science is around the quant, and then we work together to come out with something that is going to be equitable, acceptable, feasible, and hopefully people will go with it. But also it's important to understand that people are making trade-offs about the decisions they make around their risk all the time as well. And most of the time, almost all the time, they are rational too. So if they're not behaving in the way that you would like them to behave to mitigate their risk, there's often a very, very good reason for that. And it's working with the behavioural scientists that you understand how to address that as best you can in the advice you give.
Thank you. And Fliss, you wanted to come back as well.
I just want to say, apart from coming from the physics end of the spectrum, my mum's a prof of psychology, but I've always teased her about social sciences being less of a proper science. But we've, I think, had to learn to understand proper integration of behavioural science with hard physical science far more in the last 2 years than I've ever been properly aware of. But the thing that comes back specifically to transmission and our sort of constant question about what is the primary route of transmission is because people in general and persons individually can understand that there are a lot of different ways that something can be transmitted, and people can understand that there may be different things that you need to do in different situations. But we tend not to be able to remember things that we don't have a nice sloka for, a nice, if it's 3 words, catch it, bin it, kill it, then we can remember it. But even if we understand the Swiss cheese model approach that says, okay, there's lots of different risks, I need to do a variety of different things. Actually, as a person who isn't used to changing my behavior, we've got a maximum of 2, maybe 3 things that we can get people to work into their understanding. One of them was singing happy birthday while you washed your hands. But we need to know what are the things, although at the same time knowing there isn't just one magic bullet for any of it, we need to be able to find what are the 3 things which will most effectively protect the most people in the population and prevent the most transmission.
It's 4, isn't it? It's hands, face, space, ventilate.
I mean, you can try that, but how many people do you know who are going to say ventilate outside of protect?
That's been a really huge issue in communication, actually, to find the word for ventilate that people will remember.
And I think the other challenge is also making sure that people see each one as equally important and don't just dive into one because it might be easier or they can see a solution in that particular space. And I think that brings us back to this whole issue of translation, doesn't it? And interested in what advice you would give technical people like the Protect team as to what would make it easier for you when it comes to translating the information that they're able to provide so that you can give the best possible information to the people who are asking you the questions. And Flesh, let's start with you.
I think there are probably 2 keys. I mean, the more that we have in terms of implications, that's useful. I have to read hundreds and hundreds of papers every week. I spend a lot of time talking with my experts. It's lovely to be able to talk with the authors of papers, but being able to sort of look at something and not just come to my own understanding about what it means, but to have somebody say, we've done this piece of research. It's really interesting. These are the findings. This is what we think the implications are for all of the things that are going on at the moment. Actually, due to this piece of research, probably we don't think that ozone machines are going to be a really good idea in classrooms because we're missing all of these chunks of information about what ozone does to children and so on and so forth. But actually, it might mean that multi-filter technology where you use HEPA and UVC or where you use carbon filter and could have really, or maybe we're closer with this technology. Maybe we know this about. So the opportunity to talk with the authors and the opportunity to understand the implications for our policies and for our other investigations, that would be most useful.
Thanks, Liz. Good advice. Emma.
Yeah, it's a really good question, and it's one that's predated COVID as well, hasn't it? I think it is really about a dialogue and understanding that the policy decisions don't happen in a coherent and linear fashion mostly. And I think that as a researcher, that can be quite frustrating because you can see where the problems are, but often as a policy opportunity will arise almost not randomly, but you may see it on the horizon, but you don't know when the opportunity is going to arise. And it's really important that, it's really important for me to know who are the people, like Felicity said, that I can pick up the phone and say, look, what do we know about this? And what are the bite-sized pieces of evidence consolidated to help them make a decision that makes sense and is supported by evidence? So often the evidence can be very detailed evidence, but the opportunities are around quite a limited area, and it's being able to pull that out and being able to talk to researchers and know who it is out there who can help you find the answer that you need, often with 30 minutes notice. So it's difficult, but I think it's a lot to do with the relationships and about having a conversation for you as researchers to understand what is on our horizon in terms of policy development, and to also be able to feed in if something is bubbling over, or if you think that there's something useful for us, to just talk to us, let us know what you've done, what the limitations are, how it might be valuable. We can usually see where it fits in with everything else. So yeah, come and talk to us. That's probably the main thing.
Paul.
Implications. That's what it's about. I joke that I don't read anything other than the exec summary of virtually anything that I'm sent. I don't quite read 200. I read a lot a week, and if I don't get the message from the exec summary, I don't get it. I will relate just a very brief story that, on the 23rd of December last year, I was sitting in the front of my car with Andrew and Kath on the phone, line by line editing the exec summary of the latest report on the 23rd of December. And we put a lot of effort into getting those words right, every single word right, and every confidence right, because actually that was going to drive some fairly big policy decisions. So get your exec summary right, get your implications right, get your uncertainty right, but give that implications is absolutely important. The other thing that I would reflect, I've probably never read so much material on preprint servers than I've ever read in my life. Yeah, I don't know if that's a good thing or a bad thing, and we could discuss that, but I've never probably read preprint servers as much. And I eat up any review, any integrative review that brings that information together. It's like gold dust. It's like gold dust. And actually, when you get three in an area which all seem to say the same sort of thing, actually it gives you that real confidence. So it is that implications bit for me. It is actually what is the thing that I want to take home. And this has been outside COVID, we've been in science for a long period of time. There's a lot of information. How are we making it digestible? But I think it's really come down to bear now as part of that kind of getting that information across. Policymakers don't have much time. We get a lot of information that we've got to digest as scientists to give to them. If you can pre-digest that for us, that sounds a bit horrible, actually, doesn't it? But it is actually essential.
And you're going to have to call your mum a bird now. You're going to have to call your mum a bird now.
I was unfortunately going to pick up on that pre-digestion point again, because I think one of the things that's really important is that when you look at COVID, the way that we've looked at information has changed. And you mentioned the preprint approach. Yeah. There's so much information coming out. There's so much information that hasn't necessarily been through the normal scientific review processes. So how do you make sure that we're not just responding to a single paper, a single view, something that might not be quite as robust when it comes to the normal criteria for scientific evidence? How do you make sure in your roles that you're not sort of moving in a bandwagon kind of approach, but you are synthesizing the information constantly so that you are providing the most appropriate advice that is available at that time? How do you make sure that is embedded in the ways that you provide advice to ministers or to other organisations?
Well, I can have a go. Ina, go.
Well, we have a rapid evidence team within the phage functions of UKHSA. So they have limited capacity. They're partnered now with the Centre for Wales. Thanks very much. We put it up for a few things. And we use them we often talk about the gaps, and we talk to some of the researchers about the gaps. And then once we've identified a gap, we set about, we're looking at the evidence using rapid methods and sometimes more detailed methods. But yes, it is systematic, even though it is rapid, it's never as quickly as policymakers would want it. But they have, over time, we've made the case that actually doing it properly and coherently allows us to be confident with the advice we're giving, and that it's been done in a systematic way. And they have learned to be more patient, actually, about the waiting for that process to complete.
Because that's a critical issue, isn't it? That time space between the information coming in and the detailed analysis that you have to do to get to a systematic review. So given the pressures that we've had in COVID, how have you been able to manage that? Is it, as you say, people have become used to it, or have you still had the pressure to say, well, I want the answer today, not in 3 weeks' time?
A bit of both. So we have some horizon scanning. We can probably anticipate a few things that we're going to be asked, but we're also often commissioned. At the start, it was very difficult to manage expectations, but now we have a formal commissioning process, and at the scoping phase, we work out how long it's going to take. And their expectations have changed, and they largely would prefer quality to a reasonable timescale than poor quality. So it's improved a lot, actually.
And I guess from your perspective, Paul, when you were doing the event research programme, you weren't being told, oh yes, we'll be happily receiving this information in 9 months' time, don't worry about it. There must have been some pressure to provide information very quickly. So how do you handle that and balance that tension between robust science and pressure to get stuff out very quickly?
Yeah, the bit we haven't really talked about this is and the ERP, the Events Research Program is a good example of this. And I was going to talk about trusted sources.
Yeah.
Because actually we've had a lot of these committees. We talked about SAGE, we talked about EMG, and what will frankly happen when you're talking about something, you say, well, I've read this paper that seems to suggest this, and then the expert will come and say, look, actually, I think it's slightly flawed that. I think it's actually slightly, so actually that clearinghouse of trusted sources and that ability in writing those sort of documents and pulling that information together, you normally get 8, 10, 12 people looking at it and going, no, actually, that isn't a particularly good study. I don't think it's based well. I mean, that was particularly a case actually in the Events Research Program where really the knowledge around transmission events was pre-COVID minimal, actually virtually zero. And the first studies that came out were I think, from Belgium and Spain, but they'd looked at like 12 people. I mean, and we were like, you can't get anything from looking at 12 people in a nightclub, yet they've drawn these beautiful implications about, what safety you should have in that. If I reflect on the Events Research Program, and again, the principles of open science and scientific independency have been an absolute key element of that throughout it. The ERP, which was in some senses the most amazing program I've ever been involved in the sense we started in February and delivered the first piece of advice and put 1.2 million people through events in the course of about 4.5 months. It's mind-boggling. But actually, at that sense, we had a science board whose job was actually, they were slightly puritanical, if I'm honest. They were slightly puritanical, but they needed that, because there was a danger that policy would run ahead of the evidence in some senses. So actually that constant tension between policy and science and trusted science, I think, has been a key feature. It hasn't always worked, let's be frank. It hasn't always worked, but that trusted sources and trusted pieces and the role of science to be independent of the policy has been, for me, a critical feature. And I guess we will find the ins and outs of that in the coming inquiry next year.
Thank you for reminding us about that, Paul. Bliss.
There are a couple of things to dig into. I think one of them, and you're right, Paul, about the sort of studies with low numbers of people, but I remember one of the things about the Events Research Program was we expected to need far higher numbers of people than we could possibly need because the prevalence was so low. We expected that we would get a very low hit rate of usable data. So thinking about the situation when you look at the quantity that you're assessing is important. That constant dialogue comes back again. Timing of available data when synthesizing and providing advice. You talked briefly about being really keen to ensure we said with a probabilistic yardstick, what degree of confidence, what degree of probability is there that we can have confidence in the results we've got? And usually if there's only one piece of evidence, or if, evidence is coming out right now, then, if it's all only on preprint and it hasn't been through peer review, then you have to say that we've got to allocate a low confidence to this. And, if we don't feel certain about it, being sure that we advise ministers, this is likely to change. Our confidence intervals are broad. If, it may be that we come back to the middle of where our confidence intervals are, but it could equally be that we go quite far to one end or the other. And the advice there is to say that although you can start to draw implications and probably you can start to think about what you might do, it wouldn't be a good use of time to announce such things as a certainty or to base big decisions on them, because you'll find yourself in a position where it's difficult to unwind. And we have been certain to maintain, even though I'm a civil servant, but as the co-chair for my group, I'm responsible for providing independent, robust advice, which is subject to change and may change from day to day, depending on the new evidence that we get. It's really useful now having an evidence centre that we can sort of throw things to, and we've set up sort of super rapid review, which is 2 days literature search, what can we find, and check with SAGE, and then there's this sort of slightly slower detailed literature review we go to, and then there's sort of further and further, and that works well. We set up a subgroup, a specific research and development subgroup for our science advisory group, and one of the things they do, as well as continue to go out to the other specialist interest groups and gather research questions, is look to see what updates there have been, or where there have been competitions about the veracity of things that we considered previously to be of high quality. But I think most broadly, it's really important to encourage robust debate, and to, we've deliberately chosen a certain number of people who are well thought of, but who disagree with us as chairs, to sit on the wider advisory group body, so that we can have friendly but robust discussion. And every paper that comes through that we need consensus on is challenged in a constructive but in quite a firm way. So we try really hard to avoid groupthink. And if we start to find that we're all agreeing on things, then we start to reach out to people we haven't spoken to to say, how do you feel about this? We could go down a rabbit hole so easily. We did, to a certain extent. The other thing that we find is, and Paul, you are so on the money with how important those little words are. I sometimes feel like we did a disservice to people by not carefully enunciating the difference between the benefit of an engineering control in, putting up a plastic screen to prevent heavy droplet distribution is absolutely useful in certain situations, and to prevent that. But if the balance of infection moves more towards aerosol, and your plastic screen isn't providing a proper sealed protection between you and another individual, then it's possible that it's going to start changing the way the airflow occurs and leave eddy pockets of increasingly high kind of levels of aerosol particles that are going to provide a viable,
No, I was just going to say, what you pointed out there, Fliss, is one of the real challenges, that actually in policy translation, nuance doesn't work well. Nuance doesn't work well. The question is, should I have a screen or shouldn't I have a screen?
Yeah.
And the answer is, you should have a screen in certain circumstances. It's actually quite a difficult position.
Yeah. And I think, what we try to do with Protect is to give some simple headline messages and be consistent with those all the way through. So the 3 routes of transmission, air, surface, person to person, is not the detail that a lot of the scientific colleagues would want to present, but actually it's an easy thing for people to remember, as you said, Fliss. The fact that we talk about risk assessment and the hierarchy of control, and even I'm getting fed up of saying hierarchy of control, but it's important because it provides a framework for people to do some thinking. So those snippets of information which have got a huge amount of evidence behind them are really important to get, in my mind anyway, the evidence across those policymakers in a clear way, so that they can use it in their own activities.
Found they remembered it better if I called it the Pyramid of Doom.
Well, there we go. The Pyramid of Doom, you heard it here first. I'm going to open up to questions from the audience in a second, but I just want to remind those of you who are online that you can post your questions in the chat function on Zoom, and we'll take some questions from there in a minute. But I'm going to open up to the floor now for your comments and questions. Yes, first question over there. We have some roaming microphones which are speeding towards you. There we go. Thank you. Can you just introduce yourself and then ask the question? Thank you.
Kevin Bampton from the British Occupational Hygiene Society, and we're always delighted to hear people talking about hierarchy of control. This question is kind of via me, which is from a bunch of health professional bodies. On Monday, we understand the new version of the IPC guidance on seasonal respiratory illnesses will be published. In Appendix 1, it clearly states that COVID is spread by droplets. That's the level of protection. Now, picking up on Eva's point, obviously there are lots and lots of trade-offs, but this is the largest employer in the country, and obviously affects lots of people, the health service. How far has the research that is being sort of put forward here, how far has that directly informed the IPC guidance that will directly inform the behaviour of various health specialists, etc.?
Thanks, Kevin. Emma, do you want to go to that one first?
Largely the PROTECT data is in the community settings. So I know that there's a fuzzy space in between, but the clinical side is the evidence is dealt with separately. I'm not aware of any PROTECT study that deals with healthcare specific settings. That might be a blind spot for me, but I'm not aware.
It's not an area that we particularly cover.
Yeah.
But I guess the more general point about that balance between the different routes of exposure and the relative importance within the guidance that's going out. And certainly, you know, I think the point you make is an interesting one, Kevin, in terms of the infection prevention control versus the guidance that's coming from central government. And sometimes, you know, those two things are serving different purposes, but interested in others' thoughts on how that might be affected by the kind of work that we're doing.
Yeah, I'm going to be honest and say this is way beyond where my trains run. So I think it's very important in science to also know what you don't know as well as what you do know. So I'm going to do something strange for a panel. So I don't know. That health setting stuff is, as in my experience of the SAGE experience, is dealt with as a completely different sort of box as to the community transmission.
Obviously a huge amount of healthcare is delivered in the community. So people going out, speech and language therapists, etc. So even that community setting stuff, is that reflected back into IPC?
I think probably what we're saying is that we haven't got anyone on the panel who can speak directly for the IPC guidance or the approach. I think what I can probably say is that through the work that we're doing on PROTECT, through the input that we have through the environment and modelling subgroup of SAGE, and as Paul says, through SAGE itself, we are providing the best available evidence for all of the bits of the system to make the best decisions on that evidence. But obviously they are responsible for deciding the context and, as all the panel have said, the translation of that information into their particular circumstances. But clearly, I think it would be for the IPC bodies themselves to answer that specific question. But the information that we're providing hopefully helps them make informed decisions about where the most important routes of exposure might be. Okay, there's a couple of questions coming in from the online audience. And the first one is about local authorities and local authority enforcement officers. And what role do you think local authorities play in the pandemic situation? Because clearly they have a big resource. They have lots of local contact with local businesses. How do you think they have played a part in managing the response to the pandemic? Paul, do you want to go first?
Yeah, so my experience of this has again been through the events research program where we had to work quite closely with local authorities, because at the end of the day, the DPH had a say about whether we could conduct these studies within their sort of domains. I think I found that relationship to be really productive. I mean, I found that relationship that it engaged the realities of local public health and that local understanding. And that local public health understanding is essential in some senses, in my view, was essential to be able to translate sometimes slightly theoretical musings on what was the best way to have an intervention into practical implications on the ground. That knowledge of the community, the structures of that community actually were essential in my view. And I think if you would reflect again over the course of the pandemic, I think you would say that there was a realization that the DPHs and the local understanding became that more and more important as it was shown really what it could deliver.
It's a really important point through the enduring prevalence work that the National Core Study has been doing in particular. So we've done lots of interviews now. The Marty van Tongeren and his team interviewed lots of local and regional directors of public health who fed through the information from the local authority enforcement people, the environmental health officers, to really understand what's going on at that local level and working through what does deliver enduring prevalence, what are the key risk factors, what can we learn from that experience. And you're absolutely right, Paul, the knowledge that is there is absolutely critical to work out the relationship between those local risk factors and the opportunity for transition. Emma, sorry, you wanted to come in as well.
Yeah, I mean, it's difficult to overstate the role of local government in the response. They understand their communities very, very well. They know where inequalities sit. They know who their underserved populations are, and they're often the ones who are disbenefited by COVID interventions as well. So we might have a suite of mitigations that we think we can deploy, but it's only the local public health teams and local government who understand what might be effective and what might not be at all acceptable, or their uptake may be minimal in a community. So we collect the evidence, and they're the ones who will be able to judge and determine how it might be best deployed. So they have been very effective. And I guess one of the benefits, the COVID silver lining is pretty hard to find, but one of them is that our relationships with local government and how we communicate with them and work with them has improved immeasurably during the pandemic. And hopefully that's one of the legacy elements.
Absolutely. Thanks, Eamon. Chris.
Yeah, local authorities at all levels have been absolutely key, not just in terms of being involved in IMTs, the strategic coordination groups, obviously the environmental health officers and the CCDCs coming together to share information and understanding and multiply up and out into a national level what we understand about the dynamics of transmission on the ground, getting quite involved in the tracing and the understanding of where exposure took place with and without the digital support, but also working quite a lot in terms of understanding. So chairs and councillors themselves, we've been spending a lot of time doing sessions where we talk through the latest evidence, what we understand about transmission. As the national restrictions are removed, there are still a lot of different things that local authorities can do. But the really key thing has been, as communicators of our understanding of risk, as communicators to the people and the people who work for the local council about what may and may not be appropriate. So doing things like deciding to change certain bus routes when there are local outbreaks, when there was low prevalence, so that bus drivers could avoid encouraging people who are very high prevalence, who are very highly likely to be infectious, to be getting onto the routes that were going to be full of people, but then providing taxi alternatives so that people weren't unfairly affected by those, right the way sort of through to having big communications campaigns about encouraging people to get vaccinated, encouraging people to stay at home during periods of high prevalence in those areas. So yeah, absolutely, probably far more important than we are.
Thank you very much. I'm going to bring it to a close because the time is running out, but I'm going to ask a quick fire round. I know this is dangerous for this particular panel, but a quick fire round, which is basically to ask you, what remaining question regarding transmission would you like the PROTECT study to answer? And I'm going to start with Paul.
I still want to know the relative weighting of the transmission routes, and because that will help us think about how to develop the environmental end of the mitigations piece.
Thanks, Paul. Emma.
I'm really sorry, that's my one too.
And Bliss.
Well, since I think the ratio is different in different circumstances, what I would like PROTECT study to tell me is outside of ventilation, how can people balance the risk of, well, not necessarily outside of ventilation, how can I advise the most people to balance their risk of infection in their own households compared to their well-being in terms of needing to keep warm and afford to heat their houses and so forth?
Thank you. Nicely timed. Thank you very much indeed. Really good conversations, some really helpful pointers there for the research community, and recognising that we haven't had enough time necessarily to answer all the questions, but there's going to be a coffee break now where people can hopefully have a conversation with you to pick up any remaining points. I think the whole purpose of this session was to provide a bit of context and to have that open discussion about why transmission is so important, and hopefully the discussion has enabled us to see that. And what we'll do after the break is present some of the evidence from the various activities that are being delivered by Protect. So I haven't been able to say this for 18 months now, but what will be absolutely fantastic will be to thank our speakers in person with a real round of applause as opposed to a virtual yellow round of applause. So thank you very much indeed. Thank you. Coffee's now served in the room to the back and to the right, and we reconvene in here at 12 o'clock. Thank you very much indeed.